So thank you guys all for joining me today. We are going to be doing a CEU, Understanding Anxiety, a Behavioral Perspective, presented by myself, Melissa Dreskis. So the topics that we're going to be going over today, I'm going to be covering four different topics, defining anxiety. So looking at it from a behavioral perspective, we're going to go into the neuroscience of anxiety. Then we're going to talk about the behavioral interpretation of anxiety. So like, what are the behaviors that you see and how is, that tied into the neuroscience and the behavioral explanation of anxiety? And then we're also going to go over behavioral interventions to reduce anxiety, focused more on just like the mechanisms of how that works. So, what to expect from this course? This course is not going to qualify you to treat anxiety. Um, I would take this course more from an interest in anxiety and the behavioral perspective of it, as opposed to taking this and now going and treating clients for anxiety, because this is not sufficient training for this. If you have additional training or you then want to seek out additional training, this is going to give you good information, but this is not the training that you can then take and treat anxiety. So that is not something you should expect from this course. Now, this course will help you understand anxiety from a behavioral perspective, and it also may help you if you have anxiety just through understanding of the processes involved and how everything works and what that behavioral understanding is of how anxiety is working. But if it does help you and you have anxiety, it's really just through the understanding of it, and maybe going over interventions if you do that just with yourself. But again, it's not for the purpose of treating your clients with anxiety. So our objectives today is that you'll be able to behaviorally define anxiety and anxiety symptoms, that you'll understand how the brain responds, leading to anxiety and specific behavioral patterns. You'll also be able to apply behavioral concepts to explain anxiety-related behaviors. And then you'll also gain an understanding of the mechanisms underpinning behavioral interventions that manage anxiety by targeting both neural and behavioral processes. So just to give you a little bit of information on myself, I have a bachelor's degree in speech language pathology and audiology, a master's degree in applied cognition and neuroscience, and I also completed the graduate certification program in ABA from Florida Tech and became a BCBA. I have over 15 years of pediatric clinical experience. I've worked as a BCBA mentor and consultant. I have graduate level teaching experience, and then I'm the owner of ABC Behavior Training, as well as the founder and editor-in-chief of Behavior Brain magazine, which is new, just came out this month. Hopefully you've had a chance to take a look at that. But I'm coming at this, and one of the reasons why I'm interested in anxiety is I've experienced anxiety throughout my life, but I also have this master's degree in neuroscience, and that ties a lot into anxiety. And as I over the years learn more about anxiety and how it ties into neuroscience, I completely see the behavioral aspect of it too, how even, the neuroscientific processes that are going on really ties into the behavioral explanation of anxiety as well. So for me, I've experienced anxiety throughout my life, pretty much my whole life. I had health anxiety as a child. As a teenager, I started having panic attacks, which led into an adulthood. Even though my anxiety is pretty well under control, I still have panic attacks, even, to this day, really depending on what's going on in my environment. All of that, previously, whenever I was having a lot more panic attacks and in early adulthood, it led to mild agoraphobia, which is basically it's fear and avoidance of places that might cause panic and feelings of being trapped. So basically, it's like anxiety about having anxiety. So that can be anything from like traffic, airplanes, crowded places, and it's not actually a fear of those things. I don't like flying, but I don't have a fear of the plane or flying itself. It's more the feeling of being trapped and you might have a panic attack while you're on the plane. So that's kind of what that is, and that it also that's a common symptom and side effect that can happen from panic attacks. And the anxiety came and went on and off throughout my life. It wasn't constant all the time, but it never went away and stayed away. So I've had lots of experience with some of the different types of anxiety that we'll talk about today. And I think that that leads to a unique perspective of having experienced these types of anxiety and also having a background in neuroscience and having a background as a behavior analyst. So first, let's take a look at defining anxiety. So anxiety disorders are the most common mental health concern in the United States. Over 40 million adults in the US, which is about 19%, have an anxiety disorder. So if you do not have an anxiety disorder yourself, you probably know somebody that does. And then approximately 7% of children aged 3 to 17 also experience issues with anxiety each year, and most people develop symptoms before the age of 21. So if you are a BCBA, working with the pediatric population, especially children with autism, I am not going to be going on about like treating this with our clients, like I've said, but it's also probably likely that you have clients of yours that may also be experiencing anxiety. And again, while we're not going over how you're going to treat anxiety, having an understanding of what they might be going through can definitely be helpful as you are working with them. So let's go over normal anxiety. So normal anxiety, everybody has normal anxiety and stress and all of those things. It's contextual and situational. So normal worry and stress are typically responses to specific situations or challenges. So you could be stressed out about an upcoming exam, work deadline, something like that. And then short term. So these feelings are also temporary and usually subside once the situation resolves. So you're not having long-term anxiety. And then it's also manageable. So individuals can generally manage and control their worry and stress through coping strategies and problem solving. And then it just doesn't become a long-term problem. So all of that is normal. Everybody experiences anxiety. Just experiencing anxiety doesn't mean it's going to turn into an anxiety disorder. So some examples of normal anxiety: feeling nervous before a big presentation, stressing about a meeting, meeting a project deadline, or also worrying about a loved one's health. All of those things can be completely normal anxiety. Now, anxiety disorders, this goes beyond normal anxiety. It's persistent and excessive. So these anxiety disorders involve ongoing excessive worry that persists for 6 months or longer, even when there is no specific threat or reason for the anxiety. There's also interference with daily life. So it significantly impacts daily life, relationships, and really the overall quality of life because you're constantly thinking about anxiety, trying to avoid anxiety. So it's not just something that's short term and, where you're worried about an upcoming test or something like that. There's also physical symptoms that are going to be a lot more common with an anxiety disorder as opposed to normal anxiety. This can include things like increased heart rate, muscle tension, fatigue, and difficulty sleeping. And then there's avoidance behaviors, which is really a key aspect to anxiety disorders. We're going to talk a lot about that. The anxiety often is going to lead to avoidance or of situations or activities that trigger anxiety and then reinforce the disorder, making it worse and worse, which again, you don't see that with normal anxiety. So some examples here: constantly worrying about multiple aspects of life without a clear reason, avoiding social situations due to fear of being judged or embarrassed, and experiencing panic attacks and ongoing fear of future attacks. So those types of things are anxiety disorders. Now, I'm going to go over a few common types of anxiety disorders, but just know that there's more than this. This does not cover all of them. For instance, I've experienced health anxiety on and off through my life. That is a different type of anxiety disorder, one I'm not going to go over as much here, but that's like its own type. So there's a lot of different subtypes of anxiety that are under that one diagnosis of anxiety disorder. So one of them is generalized anxiety disorder. This is have some features of excessive worry. So it's persistent and excessive worry about various aspects of daily life that's difficult to control. There's physical symptoms like restlessness, fatigue, difficulty concentrating, muscle tension, and sleep disturbances. And then some behavioral indicators is avoidance of situations that trigger worry, constant reassuring seeking, and difficulty managing uncertainty. So this type of anxiety disorder, it's like ongoing anxiety that's just kind of present throughout, daily life, based on, various things that are going on. And then panic disorders. This is where there's a lot more like acute episodes of panic. Some of the features of this include panic attacks. So they're reoccurrent, unexpected panic attacks characterized by sudden periods of intense fear or discomfort. Definitely physical symptoms here. So heart palpitations, sweating, trembling, shortness of breath, chest pains, dizziness, feeling of unreality or detachment. Basically, it feels like you're having a heart attack, but you're not. And then behavioral indicators here are avoidance of situations where panic attacks have occurred, and then fear of future attacks, and then, of course, avoidance of activities that might trigger attacks. And then we have social anxiety. So this is fear of social situations, intense fear of being judged, embarrassed, or humiliated in social or performance situations. Some physical symptoms here: blushing, sweating, trembling, nausea, difficulty speaking. And then here you're going to see avoidance again. Avoidance is a really key aspect to these disorders of social situations, public speaking, situations where that individual might be the center of attention. And then there are specific phobias. So this is intense fear. It's very specific and persistent fear of a specific object, situation, or activity that's out of proportion to the actual danger. So like snakes might bite you. We should have a healthy fear of snakes, but we don't want to have this phobia where it's a completely out of proportion fear that you can't go into a pet store that sells snakes. That would be related to a phobia. So there's physical symptoms with this: immediate anxiety upon exposure, sweating, trembling, rapid heartbeat. It can lead to a panic attack. But again, it's all related to that specific situation. And then, of course, there's going to be avoidance of the stimulus that they're afraid of, significant distress and impairment in functioning due to the fear. So some common phobias are spiders, snakes, heights, storms, tight spaces, flying, elevators, needles, medical procedures. All of those can be specific phobias. Now, as I said in my example, like when we're going over agoraphobia, sometimes that can look like a specific phobia. For instance, I don't like flying. I don't really like elevators, but I get on them. But I don't have a fear of elevators. I don't have a fear of flying. So that's not a specific phobia. It's more of a, general fear of, being trapped where you can't easily get out somewhere. So that would be a difference to the specific phobias. But then again, they can have just this specific phobia without it relating to anything else. And then we have obsessive compulsive disorder. Now, as a behavior analyst, this is definitely one I've seen more often in my clients. And this is a type of anxiety disorder as well. And this relates to obsessions. So reoccurrent, intrusive, and unwanted thoughts, urges, or images that cause anxiety. And then they engage in repetitive behaviors or mental acts to reduce the anxiety associated with the obsession. And then this is going to lead to time-consuming rituals like hand washing, checking, counting, anything like that. And that often will lead to interference with daily functioning. And then the final one I want to touch on is post-traumatic stress disorder, or PTSD. So this is related to trauma, but it's also an anxiety disorder, and that develops after exposure to a traumatic event. Some symptoms include intrusive memories, flashbacks, nightmares, avoidance of trauma reminders, hypervigilance, and emotional numbness. And then behavioral indicators here is that, again, you're going to see avoidance of situation and people that trigger those traumatic memories, even though it's not directly related to that trauma. There's a heightened startle response and difficulty functioning in daily life. So like I said, those are just some, types of anxiety disorder, but there's much more than that as well. So for the behavioral definition of anxiety, we're going to be going over what that looks behaviorally a little bit more in the future. But I want to talk just briefly on, what the anxiety disorder looks like from a behavioral perspective, because it does have two different parts that we want to be aware of. Of course, we know of private events and public events, and that's part of anxiety disorders as well. So for private events, this is going to be internal experiences such as thoughts, feelings, physiological sensations that are not directly observable by others. That can look like intrusive thoughts, so persistent, unwanted thoughts that cause distress, catastrophizing, so assuming the worst possible outcome in a situation, and also hypervigilance, so constantly scanning the environment or even scanning yourself for potential threats. Now, public events, that's what we are going to be seeing, more often of that you can actually observe, but that's only one side of what the anxiety disorder looks like. And those are going to be, of course, the observable behaviors and actions that can be seen and measured by others. So that can look like avoidance. So all the actions taken to avoid or escape the anxiety provoking situations. Safety seeking, so behaviors aimed at reducing anxiety and perceived threats. And then also physical symptoms. We can still see some of those physical symptoms, such as like trembling, sweating, pacing, rapid breathing. You can still monitor like rapid heart rate. And those are all the things that we can see. So when we're discussing anxiety, the goal is not to explain behaviors solely through a diagnosis. So we're not just saying that person has anxiety and utilizing that to explain the behavior. Obviously, that's not behavioral. That's not what we want to do. But our goal is to understand the specific behaviors, both public and private, that a person exhibits in response to their environment. So when we're looking at anxiety, they're contextually inappropriate behaviors. So anxiety involves behaviors that are disproportionate to the actual context or situation. These can include, overt actions, so those public behaviors, and also internal experience, those private behaviors. So that's going to look like avoidance of social situations or excessive reassurance seeking, pacing, anything like that. And then also intrusive thoughts, physiological responses, all of those types of things as well. And all of that is included within this contextually inappropriate behavior because they're not like relevant to what's actually going on. The person is not in actual danger when they're having these anxiety related behaviors. And then environmental triggers. So anxiety responses are often triggered by specific environmental factors or stimuli, and understanding these triggers helps us identify the situations that lead to anxiety-related behavior. So that's going to look like stressful events, perceived threats, social interactions, or specific phobias, stimuli that are in the environment. So when we're talking about anxiety, I know it can be easy to think like, it's mentalistic, but it's not. It does not have to be mentalistic when we are actually describing what's going on, the actual behaviors of the person that are observable and measurable, whether, they're private events or public events, even if they're just measurable by the individual themselves, and also looking at the environment. And putting all of this together is how we can behaviorally define anxiety, which is going to look different for each individual. Now I want to talk about the neuroscience of anxiety. So I'm going to go over, the processes in the brain that relate to anxiety. And as I'm going over this, I really want you to think behaviorally, like how this may play out in real life. Afterwards, we're going to go over like a real life, example and look at that behavioral side of it. But I know whenever I first started learning about this more in depth, that really clicked for me that these things are going on in the brain and it really translates to our behaviors that we see. So for the brain and stress or anxiety, there are three main parts that are involved in processing stress, but this is a simplification of a complex process. So I'm definitely oversimplifying it. If you have a strong background in neuroscience, you may notice that. But again, I just want this to not be a neuroscience talk, but I do want to give you that background in neuroscience so you understand what's going on in the brain. So those three main parts that are involved in anxiety and stress in general is going to be the brainstem, the limbic system, and the prefrontal cortex. So looking at this image of the brain here, the brainstem is the red part, the limbic system is the blue part, and the prefrontal cortex is the green section. So the brainstem, this connects your brain to the spinal cord to communicate with the rest of your body. Its main responsibility is your survival. It regulates most of the body's autonomic nerve functions, which are essential for life. So breathing, remaining conscious, maintaining blood pressure, heart rate, sleep, all those things you don't have to think about. So an example of this is if you touch something hot and you pull your hand away immediately, this is regulated and managed by your brainstem. So if you touch something hot, you get those signals sent directly to your brainstem, and it's going to contract your muscles and move your hand away. It does not go to your prefrontal cortex. You don't have to think about it like, hey, my hand's burning. What should I do? I should move my hand away. By then, you will have severely hurt yourself. So the brainstem is the part here that is going to take action and contract your muscle and move your hand away. You don't have to think about it and decide what to do. And then we have the limbic system, which is going to be really a big focus of the anxiety part of this talk here. It's one of the oldest parts of the brain in terms of evolution. It handles responses that are related to memory, emotions, and stress responses. It also includes behaviors needed to survive, like feeding, reproduction, caring for our young, and also the fight, flight, or freeze response. It detects danger in our environment, and then it also releases hormones such as cortisol, which travel through the blood and tells other parts of the body to react to stress. People with anxiety are found to have more active limbic systems than others, which may explain part of the reason why their anxiety turns into anxiety disorders. So one part of the limbic system is the amygdala. So this plays like a really important role in processing emotions, especially fear and threat. So during a traumatic event or, an event of high anxiety, the amygdala becomes highly activated, creating a strong emotional memory associated with the event. So this is what is activated during fear conditioning. So there's heightened sensitivity to potential threats, and then that can lead to exaggerated fear responses to innocuous stimuli that may resemble aspects of the original event. So even though, you're in a situation experiencing anxiety, and it has nothing to do with the traumatic event, there may be similarities that are triggering that basically by your amygdala. They're noticing it and detecting this as a threat, and then triggering this anxiety response. So that hyperactivity of the amygdala can contribute to the persistence of anxiety and fear, even when there is not an actual danger present at that moment. Another part of the limbic system is the hippocampus. This is responsible for memory consolidation and contextual memory. So that's memory related to like the emotional, social, spatial, and temporal aspects of an event. During a triggering event, the stress response can affect the functioning of the hippocampus. So it's going to impair the accurate encoding and storage of memories related to a negative experience. Not always, but it's something that can potentially happen. So then the memories become fragmented, disorganized, and difficult to recall. And emotional memories of the event can actually become overly vivid and intrusive, and then that contributes to experiencing flashbacks or nightmares. And then we have the HPA axis. So this is also a really important aspect of our stress response. This is the hypothalamic pituitary adrenal axis. So when somebody experiences trauma or extreme stress, the HPA axis becomes activated, and then that leads to releasing stress hormones, including cortisol and adrenaline. And then in the aftermath, there's dysregulation of the HPA axis, which can occur. And then that leads to prolonged elevation of stress hormones, even though there's non-threatening situations happening. So like your HPA axis keeps becoming activated even when there's nothing going on to activate it. So that constant state of heightened arousal can contribute to anxiety, hypervigilance, and also difficulties in calming down. So the process here is that it begins with the hypothalamus. So this is the region of the brain that detects stressors. When stress is perceived, the hypothalamus releases a hormone called CRH. Now, the CRH then signals the pituitary gland to release another hormone, ACTH, and then that travels to the adrenal glands, which are on top of the kidneys. And then in response, the adrenal glands release cortisol. So we've all heard of cortisol. That's like the stress hormone. Cortisol mobilizes energy reserves by increasing blood sugar levels, which provides the body with a quick burst of energy. It helps prioritize functions essential for survival, such as cardiovascular and respiratory system. And then it suppresses non-essential functions like digestion and the immune system, because those are not important when you are trying to, fight for your life if something's attacking you. And then there's a feedback loop. So once the cortisol levels in your bloodstream reach a certain threshold, it sends feedback to the hypothalamus and the pituitary glands, signaling to stop releasing those hormones that are keeping this process going. Now, the feedback loop is really important for maintaining the balance in the stress response, because you don't want to just stay in this heightened manner for excessive periods of time. You want to have this quick burst of energy, focus on your survival, and then once you're safe, everything should start coming back down again. We don't want just unlimited supplies of cortisol in our blood. And that's what is important for that feedback loop with this HPA axis. Now, this is really, a good system that we have, right? In terms of evolutionary aspects, we need to have this survival aspect. So, it's adaptive in the short term. It's going to help the body respond effectively to immediate threats. So we do need this. It is definitely a functional aspect we have to our survival. But then there's long-term issues with this, in daily life when we are having prolonged stress and anxiety. It can have chronic activation of the HPA axis, and that leads to dysregulation, because you don't want this thing to be activated ongoing all the time, because you're having stress at work or you're having anxiety. So having these persistent high levels of cortisol, that's associated with various mental health issues, including anxiety disorders. And then the continuous exposure to stress hormones can contribute to changes in the structure and function of the brain, particularly in the areas involved in emotional regulation and stress response. So it's actually going to change your brain over time if you constantly have these high levels of cortisol. And then the final area is the prefrontal cortex. So this area is responsible for self-awareness, complex planning, problem solving, learning. It's your personality, decision making, and more. So this is like the thinking part of the brain, the part that makes you, where you can actually make decisions. So related to anxiety, this part of the brain is going to take the information it receives from the limbic system that's having all of these flags go off that something scary is happening, something bad is happening, and then it makes a decision about that information. So it's going to regulate the stress response by making things seem less scary, because you might have this sudden activation because you heard a loud noise or something happen, but then you're going to think about it and be like, oh, that's, the cat doing something or a car backfired. And you can make a logical decision about what's going on in your environment, and it's going to just calm everything down because you've now given more information to the situation. So chronic stress and trauma can impair the functioning of the prefrontal cortex. So it's going to cause difficulties in controlling emotional responses and making rational decisions. And then individuals may struggle with emotional dysregulation, impulsivity, and difficulties in effectively managing stress. And then I want to talk about neuroplasticity for a minute. So I'm sure we all know about neuroplasticity. It's the brain's capacity for making changes and adapting in response to experiences and learning. So neuroplasticity is a fantastic thing. Like this relates to our learning. We're able to recover from injuries and strokes and all sorts of things because of neuroplasticity. So it is a good thing, sounds like a good thing, but not always a good thing when it's related to anxiety. So, prolonged exposure to anxious thoughts and emotions can strengthen neural pathways associated with fear and distress. So, your brain is not like making decisions about, I'm going to have neuroplasticity for, learning a new language, but I'm not going to have neuroplasticity related to anxiety. It's not doing that. You have neuroplasticity. You're going to strengthen pathways that are associated with whatever you keep thinking about on an ongoing basis, whatever you keep doing with your brain, whatever thoughts you were giving all the attention to, and that you keep repeating in your head, that is going to strengthen those neural pathways, whether they're good for you or not good for you. So it's kind of like wearing a path on the floor from pacing, but it's in your brain, basically. So these reinforced neural pathways can create a cycle where our responses become more automatic and habitual, making it even more difficult for us to break free from persistent anxiety and avoidance behaviors because you already have that as a habit. It's automatic. You already have these scripts in your head, and it's much easier for your brain to make those connections and go in that direction because you have continued having these ongoing thoughts over and over and over again, strengthening those connections. So, neuroplasticity is not as good when it comes to anxiety and kind of creating these negative behaviors. So, behavioral interpretation of anxiety is the third thing I want to go over today. So, causes of anxiety. There's many causes of anxiety. It can come from a specific traumatic event. It could be chronic stress, illness, or a medication side effect, a major life change, childhood adversity, hormonal imbalance, loss of a loved one, substance abuse, or you could just have a genetic predisposition to anxiety. But as we know, with all things, it's really important to make sure that we rule out medical explanations first. Even if you're not going out there and treating somebody with anxiety, like anybody that has experienced an anxiety or panic attacks or anything like that, always ruling out medical explanations should be first because one, it might not be anxiety. If you think you're having panic attacks, which feel like a heart attack, you want to make sure you're not actually having a heart attack. So you want to make sure you're healthy. And then if you're having anxiety due to something like a hormonal imbalance or an illness, well, then you need to have that resolved medically as opposed to just trying to push through the discomfort of the anxiety. So I want to talk a little bit about an example of anxiety in real life and real life, but it's a made up situation, but it's going to help us look at those neurological processes that are happening and then also the behaviors that come from having anxiety. So let's talk about somebody named Emily that had a severe sinus infection. So she went to the doctor and they gave her a steroid shot to combat the inflammation. So that's a completely normal procedure. People get steroid shots all the time. But later that day, the side effects of the steroid shot intensified, causing her to have a rapid heart rate, anxiety, and agitation, which are normal side effects of a steroid shot. But her amygdala detects these physical changes and interprets them as signs of danger, which triggers a fear response, leading to a panic attack. So the physical symptoms from the steroid shot activated Emily's amygdala. It created a strong association between the physical sensation and the fear. So what was the physical sensation she was having? It was increased heart rate, agitation, anxiety, possibly sweating, feeling hot. All of those things can be associated with a panic attack, having shortness of breath. So now Emily starts feeling anxious whenever she experiences similar physical sensations. So that's the fear conditioning. Having a fast heart rate isn't bad for you. You have a fast heart rate when you're exercising or you drank too much coffee. But those symptoms were paired with this overactive response of her amygdala and created a fear response. So now those physical symptoms, which were fine on their own and shouldn't be anything scary, are now scary for her. They cause anxiety. So when she starts feeling anxious, anytime she is experiencing similar physical sensations. So if she's exercising and you get short of breath and you have a high heart rate, she starts getting anxiety. If she drinks too much caffeine, leads to those physical symptoms, feeling anxiety. Being outside in the heat, you feel anxiety. And then having anxiety when thinking about a panic attack. So just thinking about potentially having anxiety increases your heart rate and causes more anxiety. So it just creates this vicious cycle. So that initial anxiety from the medication side effects, which again, it's completely normal to have those side effects from a steroid shot, that triggered something that was not normal. So it triggered her HPA axis, leading to prolonged release of stress hormones like cortisol. So again, your HPA axis gets activated when something scary happens. That's normal. That's fine for that to happen. But then when she continuously worries about experiencing another anxiety attack, keeping her HPA axis in a heightened state of arousal, that's not normal. That's when it leads to having an actual anxiety disorder. So Emily starts experiencing physical symptoms related to the anxiety, headaches, muscle tension, fatigue. She becomes more irritable, has trouble sleeping because the anxiety is interfering in all parts of her life. It's now way beyond just getting a steroid shot and experiencing the side effects from it. So chronic stress impairs Emily's prefrontal cortex, making it difficult for her to regulate her emotions and think rationally. She becomes easily overwhelmed by minor stressors and struggles to make decisions without feeling anxious. And then more and more stimuli get associated with the feelings of anxiety. Emily finds it hard to concentrate at work, makes impulsive decisions to avoid stress, and becomes more socially withdrawn. And that's just things that can happen over the long term. So some outcomes in this panic attacks. So Emily starts having unexpected panic attacks characterized by intense fear, that rapid heart rate, that sense of impending doom. Then to prevent these attacks, she avoids situations that might trigger them, like attending meetings, going out in public, engaging in physical activities, anything that's going to be related to those physical symptoms that she initially had that fear response paired with. And then reinforcement. So all of this avoidance provides temporary relief, which is going to negatively reinforce that behavior, making it occur more and more, perpetuating the cycle of anxiety over time. So just kind of like an example of how this may play out in an actual situation. So Emily has anxiety during activities that cause physical sensations similar to a panic attack, like exercise. Now, everybody who has anxiety, you want to overcome it. You don't want to have anxiety. So she tries to overcome it by joining an exercise class. The anticipatory anxiety leading up to the class, constantly worrying about what it will be like and what's going to happen. So that's going on even before she gets to the class. Now she's waiting for the class to start and she starts experiencing increased heart rate, fear of embarrassment if she has a panic attack in class, it's feeling it's hard to breathe. And again, none of that's medical. It is all just due to the anxiety. So she's feeling this increase in her anxiety, increase into a panic attack. So instead of staying, she packs up her things and leaves before class starts. As soon as she is back in her car, she feels instant relief and elimination of her anxiety symptoms. So everything feels better. She can breathe. She doesn't feel like she's going to go into a panic attack now that she's back into the safety of her car. So what's happening here, behaviorally speaking? So the antecedent, Emily's in an exercise class. This is a conditioned aversive stimulus, even though there's nothing actually dangerous going on. Behaviors that we see, there's increased heart rate, intrusive thoughts, shortness of breath. The limbic system is responding as if there is a threat present. And then the consequence is she flees the environment, she leaves and gets an immediate reduction in her panic symptoms. So she is now negatively reinforced for leaving the class. So what is that going to do? That is going to make things worse over time. So avoidance behaviors, as we saw as we were talking about anxiety disorders, that is a key aspect for like basically every anxiety disorder. There's some form of avoidance. So the most comfortable way to deal with anxiety is to avoid it altogether. Just don't interact with the things that give you anxiety. And there are many ways that people do this. It is not the best way to obviously address this, and we'll go over that. But these are types of avoidance behaviors that people have with anxiety. So one is safety items, so carrying objects that provide a sense of security and reduce anxiety. So like never leaving the house without your water bottle to prevent dry mouth, calm nerves. Medication, so always keeping anti-anxiety medication or rescue inhalers or whatever might be related to the anxiety, stomach medication if that's a symptom, and then comfort objects, so like carrying things like stress balls or Lucky Charms or fidgets or any sort of personal item that makes somebody feel safe when they're having anxiety. Avoiding certain places, so just steering clear of locations that trigger anxiety, like crowded places, malls, concerts, public transportation, specific locations, so places associated with past trauma or negative experiences. Social avoidance, minimizing or avoiding social interactions to prevent anxiety. So declining invitations, not attending parties, gatherings, or events, limiting conversations, avoiding small talk or deep conversations, particularly with unfamiliar people, specifically if somebody has social anxiety. And then also over preparation. So excessively preparing for situations to avoid feeling unprepared or anxious. So detailed planning. This may seem like, this is just part of somebody's personality, but this, as we can see, can be part of an avoidance behavior. So detailed planning, creating comprehensive plans for events, including multiple contingency plans, rehearsing, practicing speeches, presentations, or social interactions repeatedly. And then also distraction techniques. So engaging in activities to just distract from the anxiety provoking thoughts or situations. That can be through the use of technology, excessive use of smartphones, watching TV or playing video games, or just being really busy at work. So focusing on little tasks to avoid dealing with larger, more stressful issues. Again, this seems like something that, that's a good strategy. Distract yourself so you don't have anxiety, but it's really just going to be an avoidance behavior. And then seeking reassurance. So constantly asking others for validation to alleviate anxiety, asking friends or family if everything's okay or if they did something correctly, or medical reassurance. So repeatedly visiting doctors or checking symptoms online can be related to that as well. And then physical avoidance. So using physical actions to create a barrier between yourself and anxiety. So like sitting near exits, so choosing seats that allow for an easy escape, or even isolating. So like staying in a bedroom if there's other people coming over to avoid interacting with others. And then using technology as a barrier. This is also a part of distraction as well, but relying on devices to avoid directly interacting with people. So like using headphones so you don't have to talk to others, or looking at your phone constantly so you don't have to look at other people or engage in social interactions. And then also changing routines. So just changing your daily routine to avoid anxiety triggers. So taking different routes that might take longer or they're less direct to avoid certain places or people, or adjusting your schedule to avoid peak times or busy periods like dealing with traffic. And then limiting activities. So just reducing participation in activities that could trigger anxiety. So like in my example, exercise avoidance, so not engaging in physical activities that increase your heart rate and mimic symptoms of anxiety, avoiding certain foods or drinks that can cause physical sensations similar to anxiety, like caffeine or coffee. So all of these avoidance behaviors, even ones that seem like, what's the problem with that? Like you're just distracting yourself and you're avoiding your anxiety. All of them are going to lead to an increase in anxiety symptoms. and they get negatively reinforced by the avoidance or the delay of the anxiety trigger. So this overall is going to strengthen and increase avoidance behaviors. Many people might not even notice that they are doing these behaviors, or they could perceive them as their own preferences or just their personality traits instead of avoidance behaviors. And then over time, the person's world gets smaller and smaller, and the anxiety and the avoidance grows and grows because it's not just going to stop at that one thing. You avoid one thing, but then you go out and you feel anxiety with something else, and now you're avoiding that too. It's just going to create this giant cycle of more and more anxiety and less engagement in the environment. So this is just a visual of the behavioral cycle of anxiety. So you have anxiety, then you're going to have an increase in scanning for danger. Physical symptoms intensify. Your attention narrows and shifts to yourself. You're constantly focusing on your anxiety and what's going on. And then you engage in escape or avoidance behavior, or those safety behaviors, just to not have to deal with the anxiety. You get that short-term relief, and that's the problem. It works in the short term. You can breathe, you feel calmed down, you don't feel anxious anymore. It worked. But long term, it's not adaptive. It's going to increase the physical symptoms of anxiety. You're going to have more worry, loss of confidence about coping, and increased use of safety behaviors, which then in turn is going to increase your anxiety. You're always going to find something to be anxious about. So going through this cycle and engaging in those avoidance behaviors is not adaptive. It's only good for the short term, but in the long term, it causes more problems. So now I'm going to go over some behavioral interventions to reduce anxiety. So these interventions focus on modifying behaviors to manage and reduce anxiety. The goal is to break the contingency between the triggering stimuli and the anxiety-related behaviors. These interventions target avoidance behaviors, incorporating therapeutic techniques, and utilize evidence-based strategies. But like I said before, although we're covering these interventions, this is not sufficient training for you to implement them without additional training, mentorship, and potentially additional credentialing as a licensed mental health professional. So we're going to go over these for informative purposes, but again, don't just take them out and start trying them out on people. You can probably try them out on yourself if you want, but not with our clients. So the first one is extinction of avoidance behavior. And I think this is probably one of the most important ones and the one that sucks the most to do because it's uncomfortable. But this is going to reduce anxiety by gradually exposing individuals to feared stimuli without allowing avoidance behaviors. So those are all of those things. Like think about those things that somebody just normally does in their life. They have safety items with them, probably, in their purse or backpack. They take their water with them. They have, these things that they feel more comfortable that are with them. They overplan, like they do these things. It's just part of their daily life now, and they need to stop them because those are avoidance behaviors. Then exposure therapy, you can gradually expose the individual to the anxiety-provoking stimulus in a controlled and systematic manner until the anxiety diminishes. And response prevention, so preventing the avoidance behavior to break the cycle of negative reinforcement. The extinction helps the person learn that the feared stimulus is not harmful, and it does reduce anxiety over time. I say that it sucks because you have to go through the anxiety. You're going to have anxiety when you're doing this, and you just have to push through it and not engage in avoidance behaviors, which is really hard to do when you've been doing it for so many years. Then acceptance and commitment therapy. So I'm going over this. I'm familiar with acceptance and commitment therapy, but it is not my specialty. But this is a therapeutic approach that encourages accepting anxiety rather than avoiding it and committing to value-based action. So like what's important for you? What are your goals in life, and making sure you're always taking action in relation to that. So the acceptance, teaching individuals to accept their anxiety-related thoughts, feelings without trying to change them. So we're not trying to distract ourselves from the anxiety. We have anxiety. related thoughts and feelings, and that's okay. And we're just going to move through with our life and just continue living our life, regardless of those feelings. And then commitment, helping individuals identify their core values and commitment to actions that align with those values despite experiencing anxiety. So this helps build psychological flexibility and reducing the impact of anxiety on their lives. And then we have cognitive behavioral therapy, or CBT. So this is a widely used approach that combines cognitive restructuring with behavioral techniques to address anxiety. A lot of it is related to those private events, those negative thoughts that people have, recognizing those automatic thoughts that arise in anxiety-provoking situations, and then challenging those thoughts. So, like, what's the evidence for this and against this thought? If you feel like you're going to fail, well, what evidence do you have that you're going to fail? And teaching somebody to question their thoughts and not just, wear that path on the floor of these negative thoughts constantly. So this targets both thoughts and behaviors, which thoughts are behaviors. So really, we should say that they target public events and private events, providing comprehensive anxiety management. And then we have behavioral activation. So this is encouraging engagement in positive and meaningful activities to counteract anxiety and depression. That does not mean avoiding anxiety, but doing something like exercise counteracts anxiety, like engaging in exercise, also just engaging in enjoyable activities. Those things can increase positive experiences and reduce anxiety because you're not focusing on the anxiety constantly. And then by setting goals to build this confidence and engage in these activities can help reduce anxiety as well. And then mindfulness-based interventions, there's lots of research on this. This is really, really helpful for anxiety because things like breathing exercises, like physically, that is something that's going to stop anxiety. If you're hyperventilating because you're holding your breath and you pause and you start taking deep breaths, it's going to stop that and slow your heart rate down to reduce the anxiety. Mindful meditation, practicing focus and attention and awareness is going to help reduce those repetitive thoughts and anxiety, really grounding to what's going on in the moment around you instead of letting your thoughts run off with you and go through this cycle and spiral of anxiety. And then positive muscle relaxation. This is a technique that involves tensing and relaxing muscle groups. Usually you can go head to toe or, other way around, and just doing this in a structured, systematic manner to reduce physical tension and anxiety. It can follow a sequence of muscle tensing and relaxing to have that physical relaxation. And there's also a lot of like guided relaxation audios that do that as well. But it helps manage some of those physical symptoms of anxiety, makes you focus more on what's actually going on in your body, and helps provide overall symptom relief. And then social skills training for individuals who have social anxiety. So like role playing, practicing social scenarios to build confidence and reduce anxiety in real life situations can help. Feedback and coaching, so like receiving constructive feedback and guidance can also help. And also see that like, those things that somebody with social anxiety are fearing are not necessarily going to happen, and they can get more positive practice with situations that are not negative, and they can do it in a safe environment. Psychoeducation is also really, really important. I would say, when I first learned that what was going on with me was anxiety, just understanding what was happening was enough to stop and reduce those anxiety behaviors. So understanding anxiety, learning about the physiological, cognitive, and behavioral aspects of anxiety, just understanding that itself can reduce the anxiety. And then you can also learn coping strategies. So developing practical techniques to manage anxiety, such as relaxation, problem-solving skills, all of those can help. So the psychoeducation provides individuals really with those tools to understand and manage their anxiety effectively, because they can just know what's actually going on inside their body without going off and having excessive worries about it. And then behavioral experiments. So this is actually a part of cognitive behavioral therapy as well. But this is testing beliefs and assumptions related to anxiety through planned activities. So, hypothesis testing. So, when we have anxiety, we are having these, behaviors that are not related to real life and what's actually happening. It's not proportional to what's happening in real life, I guess I should say. So you can create and test hypotheses about the feared outcomes to challenge the irrational belief. And then you can even collect data on it. So collecting evidence to support or refute the anxious thoughts. So if you have a fear of flying, what is the fear that's going to happen? Okay, let's look at all of these planes that are taking off every day and nothing's happening to them. You can get on a plane and you'll be fine and nothing happens to you. So like there's ways to collect that evidence, and it doesn't even have to be something so concrete as that, as planes taking off and landing safely. It can be really about any sort of irrational belief or anxious belief that somebody has. And then this is going to be helpful because it really makes you confront and challenge your anxiety related beliefs and actually look at the data to see if your belief is rational or if it's not rational. And that can help you overcome the anxiety as well. And then the final one I want to talk about is contingency management. So using reinforcement or punishment strategies to modify anxiety related behaviors. But again, we want to lean more towards reinforcement techniques. So positive reinforcement is really helpful here, rewarding behaviors that reduce anxiety. So, just taking note of when somebody or even yourself is engaged in practicing relaxation techniques, engaging in meditation or yoga or anything like that, breathing exercises that are going to help overall reduce anxiety, and looking at what are those behaviors that we want to increase instead of just focusing on stopping the anxiety. We want to be giving our body something else to do to neutralize these anxiety responses that we're having. And behavioral contracts can be helpful with this too. So having agreements that outline specific behaviors and the corresponding rewards or consequences for following or not following that contract. And it provides structured incentives for engaging in adaptive behaviors and reducing anxiety. I also want to touch on anxiety medication, even though that's, not something that we would be implementing, and it's not necessarily behavioral because it is using chemical mechanisms to reduce the intensity and the frequency of anxiety symptoms. So this is working, of course, because it's masking the symptoms. The medication is going to reduce the anxiety symptoms, allowing individuals to confront triggers without experiencing the debilitating anxiety. But it can also build confidence. So managing these triggers while on medication can build confidence and resilience. And then while working, of course, with a professional, gradually reducing the medication as the person becomes more confident in managing the anxiety, you can achieve a balance and potentially even come off of anxiety medication. Again, if the doctor recommends this and you're working with a professional, because while you're taking the anxiety medication, this can also help by breaking those contingencies between the stimuli and the behaviors. So, if you have a fear of going grocery shopping and being in crowds and having to stand in line and all of that, and every time that you did that, you started feeling anxiety symptoms, and that led to avoidance behaviors. Well, now you can do that with anxiety medication and you're not feeling the anxiety. So just doing that, that's helping to break those contingencies. So if you gradually come off of the anxiety medication and you can continue to go because you've now had this long learning of experience that you can go in those environments and not have anxiety, then a lot of times that can potentially continue even with a reduction of that medication because that contingency has been broken over time through the use of those chemical mechanisms. So overcoming anxiety, there's no quick fixes or magic solutions to fix anxiety. Even anxiety medication isn't a fix or, permanent fix for it. Sustainable progress requires time, effort, and persistence. And confrontation is key. So, like I said, going over extinction for those avoidance behaviors. The avoidance behaviors need to be addressed to break the cycle of anxiety, and that is oftentimes the most uncomfortable thing, especially with panic attacks or severe anxiety, because it's so uncomfortable going through that without trying to, escape from that anxiety and not feel those feelings. So confronting anxiety provoking situations gradually is going to reduce their power over time. But if we continue to avoid them, then you're never going to get over that situation. So embracing discomfort is a big part of it. Accepting and embracing the discomfort is essential for growth. Leaning into the fear and just waiting for the anxiety feelings to pass. While uncomfortable, it allows for desensitization and increased resilience over time, and ultimately really taking away the power that those anxiety symptoms have in your everyday life and in what you choose to engage in. So thank you guys so much. But if you have any questions, you're also more than welcome to email me at mdruskus@abcbehaviortraining.com, and you can check out more information about this CEU and other upcoming resources and content that I have at abcbehaviortx.com and behaviorbrainmagazine.com.